Hello everyone, this is Mila. Today I'm reading chapter 12, Lung Disease. The young mother sleepily opened the door into her toddler's bedroom to check one last time on 2-year-old Christian before she went to bed. As she bent down to kiss her forehead, sheer terror overcame her. Her son was blue and not breathing. After calling 911, she began trying to resuscitate him. The paramedic, they continued to perform cardiopulmonary resuscitation because the little boy's heart had stopped beating. But only the ER doctor was successful in getting Christian's heart and lung to respond. The once lively little boy was admitted to the hospital with the diagnosis of cerebral asthma. The doctors stabilized Christian and started him on a drug called serofalin, which delivers the airway. So his parents were relieved that Christian had survived. They were terrified about his future. They had no idea asthma could manifest itself so suddenly or become so severe. Obviously, motivated to be sure Christian recovered all of his medication. His parents took the fragile boy home. Minimal lungs reserve married Christian childhood. He could not participate in a normal rambunctious activity with the other children. And as he grew older, the doctor kept adding more and more medication because his lungs were just not performing well. Then, when Christian was age 15, it happened again. He experienced another severe asthmatic attack. Passing out at home, he quit breathing again. With flashback from the past, his parents called the paramedic as they attempt to resuscitate their son. His heart and lungs finally respond only after the family reached the ER. After this hospital admission, Christian was placed on the anti-inflammatory drug prednisone, as he would continue to take for the next 14 years. At the age of 27, with little lung function left, Christian was taking 9 different drugs. His pulmonary function tests showed that his large airway worked at only 70% of normal capacity, while his small airway were working at merely 8%. In spite of all his medication, Christian was barely able to live his life, unable to do anything require physical exertion. He lived with the resident fear of having another acute asthmatic attack. He had to continue to make sure he had his inhaler and backup with plenty of medication. His life depended on them. It was at this time that Christian decided to try building his body up by taking a potent antioxidant and mineral tablet with each meal. Within 90 days, Christian could tell he was doing better. Because of this encouraging result, he began taking some additional vitamin C, calcium, magnesium, and grape seed extracts. Over the next 12 months, Christian's lungs function improved enough that his doctor finally took him off the prednisone. Christian once said to me, "A person should only be prednisone 14 days, not 14 years." Christian repeat pulmonary function tests show consistently significant improvement. After being on the supplement program for 2 years, Christian found that his large airway were working at 87% of normal capacity and his small airway were working 56%. Not bad considering he had decreased the number of medication he was taking from the 9 to 3 during this time period. His respiratory inhaler used to last only 1 month. Now it lasts at least 6 months, and half the time he doesn't even know where is it. Today, Christian is able to participate in sports, exercise comfortably. His asthma is simply not controlling his life anymore. Lungs and air pollution. When you consider the major cause of oxidative stress in the body, the most serious and the most patent cause enter to body through the respiratory tract. This begins with nasal pathway and ends with the very thin alveoli of lungs. The air that we breathe today is filled with ozone, nitrogen oxide, fuel emissions, secondary cigarette smoke, in short, breathing, cough out. I will never forget my long journey to San Diego to start my internship at Mercy Hospital. I stopped along the way to see friends in Azusa. The smog was unbelievable, especially for a small-town boy from South Dakota. The next morning, my friends took me outside in his yard to look at the magnificence and the Barber Mountain. There was only one problem: we could not see them. I will never forget when he took a deep breath and told me how great the fresh morning air felt. I took a deep breath and couldn't stop cough. In fact, later that day, I was out playing a round of golf, and every time I took a breath, I coughed. After about 7 holes, I had to quit. I was embarrassed because I couldn't even stop coughing when the other players were trying to hit their shots or putting. Anyone who knows me knows how much I love to play golf. For me to quit in the middle of a round of golf, it had to be bad. It was odd to hear locals in Azusa jokes about not trusting their air they couldn't see. This was my introduction to what the news later reported as a moderate smoke day. Air pollutants cause tremendous amounts of oxidative stress in the respiratory tracts, and in turn the body, when you add the most patent cause of oxidative stress to the body, cigarette smoke, you put your nasal pathway and lungs literally under attack. Still, God did not leave us defenseless. He created a sophisticated and elaborated defense system against this attack on our respiratory system. The natural protection of the lung. The first lining of defense against this poisonous pro-oxidates is called the epithelial lining fluids, ELFs. From your nose to the tip of your lungs, the cells are covered with thick mucous lining. Epithelial cells themselves have cilia, which form a very fine brush border. This brush border sweeps the inhaled foreign particular, bacteria, virus back outside. The thick mucous lining contains many antioxidants that then neutralize inhaled pollutants like ozone, nitrous dioxide, and fuel emission. They provide a layer of protection that is so effective that most of the time, those pollutants don't even come in contact with underlying epithelial cells. With ELFs as the first lining of defense, the mucus, cilia, and immune respond for a team that is extraordinarily effective in preventing infection. In the respiratory tract, the underlying epithelial cells actually produce and secrete several antioxidants into this mucous barrier, including vitamin C, vitamin E, glutathione. All of this work hard to neutralize all the pollutants we inhale and thus protect the underlying lung tissue and lung function. Vitamin C most prominent in antioxidant preventive fluid lining. It is not only an important antioxidant in the fluid but also has the ability to generate vitamin E and glutathione. Still, respiratory tract infection or exposure to airborne pollutants can overwhelm those local antibacterial, antiviral, antioxidant system found in the epithelial lining fluid. When this happened, a tremendous inflammatory immune response occurred. The fluid in the lining of the lung become very thick as the immune response attacked in many white cells that literally attack with the invader organism of polluted. As you have learned already, our immune response can cause an exaggerated amount of inflammation. If the invaders are quickly cleared out, everything settles down, but an inability to terminate control the inflammatory response can result in injury to the underlying epithelial cells. This turn can lead to chronic inflammation that causes marked damage to the lungs, tissues, and impaired system. Asthma. The chronic inflammation in the lung causes significant fatigue and depletes our immune system. Whether the immune system is fighting a chronic infection or pollutant in the air, chronic inflammation takes its toll as asthmatic, especially children. Kids seem to continue fighting one infection after another, and their energy level is nowhere near that children were healthily airway. When I was first began my private practice in early 1970, physicians believed the underlying problem with asthma was bronchospasm. This is a condition in which the circulatory muscle surrounding our airway tube actually go to the spasm, narrow the pathway of our lung, results in very tight feeling in the chest, shortness of breath, and wheezing, usually loud enough to hear without a stethoscope. Our first line of therapy back then was use drugs like serofalin or albuterol, which primarily work on relieve the bronchospasm. If the person was in serious trouble or even had to admit to the hospital, we would then add a patent anti-inflammatory medication called prednisone. After a few years into my practice, however, research started to reveal that the underlying problem with asthma was a chronic inflammatory response. Our therapy changed considerably, and we shelved serofalin-like drugs in favor of anti-inflammatory drugs. Inhale steroid or Intol as a first-line therapy. Research conducts over the past decade has since conducted the underlying cause of asthma. The most every chronic lung disease is oxidative stress. My children's physical education teacher told me that when she began teaching 20 years ago, she would ask school kids to run a mile. It was no big deal. Now the story is altogether different. When she asked kids to run a mile, she ended up with 2-pack full of inhalers. Asthma is literally an epidemic in our children across the US and industrial world. When I spoke in London and Netherlands, the greatest concern the audience member was the severity of asthma present in their children. I've found that our current generation of children worldwide exposure to more airborne pollutant than any previously generation. I see children who haven't even reached 2 years of age who are suffering from serious asthma. The amount of drugs children are taking just so they can breathe in mind-boggling. Most drugs are now aimed at decreasing this inflammatory response and relaxing the accompanying bronchospasm. Nevertheless, the underlying root problem, oxidative stress, remained unaddressed. I have read several clinical trials in which patients with asthma showing significant depleted antioxidant in the extracellular fluid lining of their lungs. Antioxidant vitamin C, vitamin E, beta-carotene were found at low level even when the children were not having an acute attack. They also inhibit even when the children were not having an acute attack. And markedly higher level by byproducts produced by oxidative stress leading to chronic inflammation and hyperactive of the airway. Aiden's story. Aiden developed a serious cause of bronchial asthma at the age of 3. It was difficult for his parents to see him struggle simply to breathing. The little boy consequently took several different medications and used a nutribolics and breathing machine that mixed medication with a normal saline to receive his arbitrary treatment. But he didn't tolerate his medication well because it has stimulant quality. Aiden had a difficult time falling asleep, and as he struggled with heart palpitation, more discouraging was the fact that even with the medication, he was unable to run, play ball, or participate in even the simplest activities. He was frequently fighting colds and made a lot of trips to the ER when he had trouble breathing. The most frightening time came on Aiden's 4th birthday. He had developed a cold and quickly become very ill. He began to run at 105 degrees temperatures, and X-ray in the ER revealed a severe case of pneumonia and out-of-control asthma. Few of us think of our children possible dying from pneumonia these days, but the threatening reality certainly crossed the mind of Aiden's parents. The birthday boy was fortunately and survived this serious illness, but it left him even weaker and his underlying asthma remained a severe problem. Aiden continued to have problems tolerating medication the doctor prescribed. So they were doing everything medical possible for him. Their answer wasn't good enough. His father began to look into other possible therapy that might help his son. As his dad told me Aiden's story, he remembered that it had been earlier summer when they decided to experiment with a potent chewable multivitamin to see if it might help. He distinctly recalled in that earlier summer, Aiden would stay near the edge of the swimming pool, barely venturing out into the water. But by the end of that summer, his son was swimming the full length of the pool. With 60 days, Aiden changed from a child who could virtually do nothing physically to one who could keep pace with other children. Aiden also started playing baseball and eventually even soccer. In fact, he qualified for a traveling soccer team over the following 4 years. Aiden was not only able to play, but he excelled in the sport. As a physician, I must say soccer is probably the most difficult sport for asthmatic player. He was able to discontinue most of his meds and needed his inhaler. Only occasionally. Eden is now 13 years old and continues to be very active in sports. He has chosen to play baseball over soccer and enjoy a life neither he nor his parents even thought possible. This young athlete continued to take patent multivitamin and has added a little group C extra and extra vitamin C to his supplement. It must be amazing for parents to see their children go from being physically disabled to being normal active, as they certainly don't miss the emergency room visit. How simple and yet profound is the potential life-changing effects of nutritional supplementation. Asthma and nutrition. I realize now that when a child comes into my office with several allergy asthma or hay fever, he was significantly depleted immunity and antioxidant defense system. By the time he visited me, he had fighting chronic inflammation in his nasal pathway and the lung for some time. In turn, it seems these children become allergic to just about everything. They have dark circle on their eyes, they're fatigued, they take lots of medication. I start them on a patent antioxidant and mineral supplement and also add some essential fatty acid in the form of cold pressed flaxseed oil and sometimes fish oil. As we discussed in Chapter 10, essential fats are important in the body's function of natural anti-inflammatory products, which helps to bring inflammation back under control. Group C extra is not only a great antioxidant, but it seems to have anti-allergen effects also. This is a strong additional supplement for the child with asthma. I usually recommend that parents give their child 1 to 2 milligrams of Group C extra per pound of the child weight. I also give these children additional calcium and magnesium supplement. Magnesium helps relax the bronchospasm of the muscle in the lung. Since spasm of the muscle is what narrows their airway, this will help them open them up. I always tell parents that it takes about 6 months to build up a child's antioxidant immune system, so they shouldn't get too anxious. If I see them in the spring, I tell parents their child will be doing much better in the fall. All of my patients with hay fever or asthma have improved using this nutritional supplement program. Some stories are dramatic like Eden, and some reflect just moderate improvements, but they all get good results. Please notice I never have asthmatic children discontinue their medication, because as I shared before, nutritional supplements are not alternative medicine. They are complementary medicine. I have enjoyed working with children with severe allergy because they respond so well to nutritional supplementation. I remember a story of one mother sharing shortly after starting her child on my recommended nutrition. Her 5-year-old was sliding in the snow. As was the custom, the mom was patiently waiting at the door with the child's inhaler. Her child was not able to undertake any activity, especially outside the cold, for more than 2 years without the aid of her inhaler. How amazed the mother grew as her little girl was able to slide in the snow all morning without once needing her inhaler. I also remember the time our family got together in Phoenix City, Iowa. My daughter's niece began racing during our walk along the Missouri River. As all good uncles do, I glowed the girl on giving my niece a hard time while my daughter beating her. My niece quickly replied she was just a thrill she could when she were wrong. She had not able to be previously due to extraction of asthma. I had forgotten that I put in her nutritional supplement a few months earlier. Adult asthmatic can benefit as well. While my wife was suffering from chronic fatigue and fibromyalgia, see chapter 1, one of the most troublesome problems she had was severe asthma and hay fever. She could not even go into the barns unless she was wearing one of those huge masks that people use when they're working with hazardous material. My wife loved her horse, and she would do whatever it took to be around them. Liz was on about 5 different medications, including allergy shots, in an attempt to control her asthma and allergy. But as soon as she began her aggressive supplement program, her asthma and hay fever dramatically improved. Once her body began rebuild this defense, Liz stopped wearing her mask and she became all medication. Occasionally, she still has some allergy problem and will take some of her medication. However, this now occurs only 2 or 3 times a year. Needless to say, our children and many adults are literally under attack from our environment. It is wearing them down. They need to support of nutritional supplementation. As in the case of Christian and Adam, medication does not hold all the answers. When people are at the end of their rope, they begin to look for options. But remember, I'm not suggesting alternative medicine. I strongly recommend the complementary medicine of nutritional supplements. The question is, why am I alone in this? Why are physicians so reluctant to recommend their patient with asthma and allergy to take nutritional supplements? It's just a misery to me. Airway and chronic obstructive pulmonary disease. There's nothing harder than watching patients, young or old, struggle with every breath, often require nasal oxygen 24 hours a day. This is the case in those with chronic obstructive pulmonary disease, COPD, which includes emphysema, chronic bronchitis, and bronchinotics. These patients are hardly able to exert themselves at all and find their pulmonary disability greater hamper in their joy of living. Not everyone is able to make a conscious choice to live in healthy environments, but preventing weighs heavily in mind. Here again, I realize it's not the year in life that are important, but the quality of life we have in those years. We need to do whatever we can now to boost our health, stimulate if it's weakened. Air pollution is a key player. Considerable evidence shows that inhalation of cigarette smoke, airborne pollutant, cause the increased oxidative stress that is the underlying cause of COPD. The resultant of chronic inflammation is one's airway create even more oxidative stress, which lead to damage of sensitive lung tissue. This eventually decreases lung function by disrupting the easy transfer of oxygen through this damaged membrane to the blood. Studies show oxidative stress is the cause of COPD. Wes McNean report in the medical journal Chest and the Novartis Foundation Symposium that he felt that there was considerable scientific evidence that oxidative stress was the cause of COPD. He discovered that many of these patients had depleted antioxidants in their lungs tissue due to the increased oxidative stress, possible dietary deficiency of antioxidants. He stated that antioxidants that have good bioavailability are easy to use in the lung, may therefore be potentially therapy that would not only protect against the direct injury effects of oxidative, but also may favorably alter the event that a central role in develop COPD. The progression of COPD is relatively resistant to traditional medical treatment, especially the use of steroids. Obviously, the first task of physical is usually to help smoking patient to quit. This is not an easy task. I found that it's more difficult to get my patient off of cigarettes than alcohol, and some neurological medication. Still, the benefit to the patient is tremendous. Consequently, I will try almost everything to help my patient to quit smoking. A principle you will find throughout this book is that absolutely must to do everything you can to decrease your exposure to those things that create increased oxidative stress. Health is not simply a matter of building up your body's antioxidant defense system. If you are developing COPD and have never been a smoker or not presently smoking, nutritional supplement may become the best way to slow down the progression of COPD. The basic principle applied with all of this chronic lung disease is just to death with asthma. The earlier you start an aggressive supplement program, the better your chance hinder progressively. Once the lung has become serious damage, as many smokers have discovered, there's very little chance of significant improve their lung function. Cystic fibrosis. Cystic fibrosis, CF, is a lethal hereditary disease, primarily made up by digestive malabsorption. The body doesn't readily absorb the nutrients from the diet, as well as chronic pulmonary lung infection. The malabsorption syndrome found in a cystic fibrosis patient primarily due to deficiency in pancreatic enzyme. In addition to the epithelial cells of lung airway also do not function well, leading to increased mucus accumulation and bacterial infection. The damage to the lung that characterizes this disease is again due to the tremendous oxidative stress that is occurring within the lungs and lining. Several clinical trials have demonstrated that cystic fibrosis patients are serious deficiency in vitamin E, selenium, beta-carotene, and the important antioxidants glutathione, found both within the epithelial cells and epithelial fluid lining of the lung. This continually inflammatory process depletes essential antioxidant need to protect the patient's lungs because of the ongoing malabsorption problem. It is important for the patient to replenish nutrients adequately. Cystic fibrosis is a perfect example of what happens when our natural immune system and antioxidant defense system are not able to function properly. The accumulative oxidative damage to the lung tissue occurs quite rapidly, and the majority of these people die therefore they reach their adult years. Recent study have brought encouraging results, namely the potential in slowing down the progression of this disease by using of nutritional supplements, by combining pancreatic enzyme supplements with the patent antioxidant supplement in the patient with cystic fibrosis. Researchers were able to bring vitamin E, beta-carotene level almost back to normal. Clinical trial also indicate that when patients take important antioxidant nutrients, oxidative stress come back under control. This patient deplete immune system also improves, so they are able to fight chronic infection better. Such clinical study provide physicians with a strong rationale for supplementing their patient with cystic fibrosis with patent nutritional supplements and pancreatic enzyme. Supplementation can only help improve a patient condition and hopefully slow down the progression of his or her disease. Shirley's story. Shirley is a beautiful young woman. She is vibrant and energetic, the picture of health. You would never guess that every day she is fighting for her life. You see, Shirley was born with cystic fibrosis. She is now 23 years old and is already in an elite class when you consider that only 30% of these patients make it to adulthood. No one realized this more than Shirley, her mother, Colette. Shirley's sister died several years ago following a biliary lung transplant because she also had cystic fibrosis. The two girls were inseparable because they both had this chronic disease. They share a bond most children never get to experience. In fact, watching her sister suffering and die following a lung transplant created a deep desire within Shirley to do whatever she could to protect her own lungs and help winning the fight against their common enemy. Shirley was 15 when her sister Lexi died. The grief was a heavy burden to bear, but Shirley also carried the weight of her own struggle. Lungs that function at only 35% capacity of most of the time. Her doctors are also want to put her on the lungs transplant list. Against the backdrop of her sister's experience, Shirley decided against this option and chose instead to try improving her lung within the use of patent antioxidant supplement. Lexi had still in her this hope. Shirley saw Lexi respond well to supplements following her lung transplant. Physicians had thought they would lose Lexi shortly after her surgery. But she was a fighter, and with the help of the nutrients, she recovered remarkably well. Although Lexi only lived a few months longer, Shirley was convinced her best option was to try to build up her own body through supplementation. She began taking patent antioxidant and mineral supplements, among with an additional vitamin C, calcium, magnesium, grape seed extract. She experienced outstanding results. Several months later, her lung function had improved over 50%. Her physician was amazed. Shirley began to anticipate in physical education and even more minor sports. She always believed that the more active she could do, the better, even so she continued to have infection and had to hospitalize from time to time, receive intravenous antibiotics. Despite these small setbacks, Shirley saw her life activity arrive almost normal level. Her decision not to go on the lung transplant list but instead to start an aggressive supplement program was the best decision of her young life. Shirley became a symbol of hope of many other children with cystic fibrosis as well. Unfortunately, Shirley's battle continued. About 3 years ago, she developed acute shortness of breath. It was more difficult than anything else she had experienced. After her doctor evaluated her, she had to inform her mother that one of Shirley's lungs collapsed and was not working at all, a condition known as pneumothorax. This certainly depressed Shirley at first, but determinedly she overcame this setback and eventually returned to a near normal life. Fully relying on the one damaged lung she has left, she continued her battle with air and victory of over-infection. Following about a pneumonia that brought her breath capacity down to 15, she again regained her activity lifestyle and shocking her doctor. In fact, her breath capacity has returned to 35%. Shirley's success story is one of the undaunted courage and strength supported by the complementary team of the best medical attention and nutritional supplement available. Shirley has learned to live one day at a time. They certainly make every day a precious gift. I have known Shirley now for more than 7 years. She has been a pillar of encouragement to me. Our lungs are probably most vulnerable to the toxic world in which we are now find ourselves having lives. While our body have a great natural defense, they still can become overwhelmed. It is imperative that we build up these natural defenses to their optimal level. The story I have shared with you in this chapter are dramatic, and they are true. Isn't it amazing how much better patients with asthma, allergy, and cystic fibrosis do when they're learning how to support their lungs naturally antioxidant and immune system with nutritional supplements? Is this the magical you are been looking for as well? Thank you for listening. Next chapter I will be reading neurodegenerative disease. See you next time.